Hi, and welcome to Ask Dr. Christian. I'm Christian Flutter, and I'm here to answer some of the questions that you might have. Today's question is, what is plagiocephaly? So what is plagiocephaly, or plagiocephaly as some do pronounce it? Today we're going to be talking very specifically about deformational or positional plagiocephaly, and this can be defined as a change to the normal shape of an infant's head. It's often seen as an asymmetry or a flattening of one side compared to the other. In some cases, it can be a flattening of the midline itself. Now, it's actually quite a common condition. Back in 2004, they had a look at the incidence of plagiocephaly in infants, and they found at 4 months of age, nearly 20% had this flattening or asymmetry to their head shape. Fast forward to 2013, and they repeated this study, and they found between 7 to 12 weeks of age, 46.6% of infants had these changes to the shape of their head. So the question then becomes, what causes this change in shape? Well, the answer lies in the name itself, deformational and positional plagiocephaly. After a period of adopting a preferred position, a child's head will start to deform in shape a little bit, and that's where we start to get that flattening occurring. So the question then becomes, what causes this positional preferencing off to one side all the time? Back in 2016, Dr. Massimiliano Murgia, a medical doctor and PhD, analysed the association between plagiocephaly and changes of normal neck motion. And they found that over 90% of infants with changes of head shape had restrictions in normal motion of the neck. Now, at Chiropractic Children's Healthcare, we've replicated this study. The results are yet to be published, but we found very, very similar numbers. Our numbers showed around 92-93% as well of infants with plagiocephaly had restrictions in motion of their neck. Now, we took it a step further with this study as well and had a look to see whereabouts in the neck the majority of this restriction is occurring. And we found that the very top part of the neck, the occipito-atlantal joint, was most frequently involved. Now, one of the reasons that we see this positioning occurring comes back down to cervical spine biomechanics. The upper part of our neck, the occipito-atlantal joint, is rather unique in its design and orientation. It almost looks like two slides sitting on either side of our neck, both of which curl up and in a little bit towards our head. Now, this orientation provides the majority of this motion, this nodding kind of motion, but because they both point in a little bit, they also can provide a little bit of rotation. So very frequently, when we see kids with plagiocephaly, it's almost like a kid has gone up one of the slides, but not the other. And it promotes rotation away and a bit of extension and a bit of tilting like this. Does this look familiar? This is a very common position that we see infants in when they have a little bit of that plagiocephaly occurring. Now, this motion would also have interesting behavioural effects. Because they don't like tucking their chin down very much, any activity that promotes tucking down can be a little bit unpleasant for them. Frequently we find that there's difficulties in the car or difficulties getting nappies changed, or they extend back, they're arching back very frequently, especially in instances like breastfeeding. So the question then becomes, what causes this? Now, there are many different things that can promote a head turning towards one side or the other and the eventual development of plagiocephaly, and your health professional will run through them with you. But we typically find either a muscular dysfunction or a joint-based dysfunction to be one of the underlying culprits here. And now these ones, in a study that we performed earlier this year, we found that even being born can have enough of a trauma to generate changes to normal neck function. And we found that between 75% and 100% of infants, depending on how they were born, ended up with changes of normal function within their neck. So this then begs the question, is plagiocephaly a manageable condition? Yes, plagiocephaly is a manageable condition and in some cases can be completely corrected. For some, merely encouraging head motion away from that side of flattening can be enough to help normalize head shape. In others, we may provide additional stretches to ensure that there is normal neck muscle activity as well. In more severe cases, helmet therapy may be required to help that head shape development. Now, as a chiropractor, we find that addressing any joint restrictions inside the neck strongly promotes normal range of motion inside the neck as well. Once we normalize that neck range of motion, we find that your child is much more comfortable sleeping away from that side of flattening, and this also helps the development of normal head shape. So I hope I helped to answer some of the questions that you may have had about plagiocephaly. And if you have any further questions, please ask Dr. Christian. To turn the head completely towards once, completely. No, it comes down to. All right, go juice. Let's go. Can you see me? How do I look? Question, what causes that? Oh, it's like a rabbit's hole. There can be many different things, and I don't like the way I'm saying these type of things. It's really, really frustrating. I'm almost finished, kiddo. Okay. So this then begs the question, is plagiocephaly? What are you doing? Okay. Oh, child.